Good morning, everyone, and thank you for joining us today. I'm Dr. Velasquez, Health Officer for Spokane County, and today I'm joined by my colleague, Ashley McGee, who is the Spokane County Community Service Department Assistant Director. One of the couple of people there that have been responsible for many of the things that we've seen in terms of addressing substance use and its aftermath. So thank you for joining us today. And we have Ashley here today for a very specific purpose. She can talk about a lot of things because she has an amazing amount of knowledge. But in April, we went to the groundbreaking of new facility. And when I say new facility, I want to emphasize that this is like the next stage of a lot of the other efforts, but we're going to focus on that today. So we thought it would be important to have a conversation with the community. So thank you for coming.
Absolutely.
And the facility that I'm talking about, the official name is the Spokane County Prevention Assessment, Treatment, and Healing Center, PATH for short.
Correct.
So since I already spelled out the whole name and what it is, tell us a little bit about what is this?
Yeah, absolutely. The PATH Diversion Recovery Center, or PATH Center, is really about creating a place in Spokane where individuals can go when they're experiencing a behavioral health crisis,
Right.
whether that be mental health or substance use. And though we have a lot of, strong services across our regional crisis system,
Right.
the one thing that we don't always have is a place for people to go. And as you know, a lot of times the options available are an overburdened ER,
Right.
is involvement with our criminal legal system, or trying to connect someone with a service that isn't immediately available in the community. And really the PATH Center is about helping to meet that need and fit that gap. It will be a community-based setting where individuals can come and receive assessment, support, and connection to the next levels of care in an environment that is designed around behavioral health needs.
Wonderful. So you said a couple of things that I think is very important for the community to kind of tie the loose ends here a little bit. So you mentioned mental behavioral health. And one of the important items that sometimes we don't talk about enough, or we should talk about a little bit more, is when you have substance use, it's not that it's 100% component, there's a 100% component of mental behavioral health, or vice versa, but there's a really high concurrence between substance use and mental and behavioral health issues. And if we're really going to address the total individual, that was one of the areas that we needed to address. So that's number one. And second, you're right. We don't have a place that people can just go.
Yeah.
Everything we have is based on some level of referral and or transfer, which is great. But what if you have a family member? What if it's yourself and you're experiencing a crisis? What if it's someone that you know? That will be the place to go, right?
Absolutely.
Okay. And people could technically walk up if they needed to.
Yes, it will be 24/7 walk-in accessibility. Obviously, after hours, there will still be a walk-in component, but it may look a little different just
Sure.
after hours. But it will be 24/7 accessible for individuals to access in our community.
Wonderful. And I know in all the conversations that we've had about substance use and mental and behavioral health in the community, that lack of 24 immediate access has been something that we have identified. I'm glad to hear that the PATH Center will address that issue for the community. Will it make it easier for people to get the support that they need? Will it make it easier for families? How will you describe that?
Yeah, the goal of the PATH Center is to make that connection easier for families and for individuals. As we know, families and individuals simply sometimes don't know where to go. And our behavioral health system is complicated to navigate in the best of times, let alone when you're experiencing a behavioral health crisis or have a family member that is experiencing that. So the goal of PATH is to make that connection easier, to create a place where families and individuals don't need to know every part of the behavioral health system. They just need to know where to go to get that connection and support.
Okay. And we've talked about substance use and mental behavioral health. So it could be either or a combination that brings you there, correct?
Correct. It could look a lot of different ways. Someone could come needing a crisis intervention. They might need a safe place to stabilize. They might need a connection to services for substance use treatment or behavioral health treatment services, or maybe just connection to community resources. The ability for the PATH Center to assess an individual's needs, and really that's where it starts, and say, what are your needs and how can we best support you in meeting them?
Okay, so that's an important key component, which is you don't have to have a specific quote unquote diagnosis.
Correct.
If you have substance use and you have issues, you need help, you don't know where to go, you can go there. Mental behavioral health, crisis, concern, issues, you can go there.
Absolutely.
It doesn't really matter, you don't need the referral. Now, tell me, I know that this is part of a continuum, meaning this is not a standalone. There are other services that have already been assembled and organized and structured. Tell us a little bit about that, all those other components.
Yeah, and I think it's important for people to know that we're not starting from scratch. You know, Spokane has a pretty robust crisis system of care that has continued to develop over the last several years in alignment with the state's crisis system redesign. So there's been a lot of work that's occurred. We have things like 988 and the regional crisis line that are able to be accessed by individuals calling for assistance when they're experiencing a crisis. We have adult and youth mobile crisis teams, as well as designated crisis responders who can respond in the community and to facilities when people are experiencing a crisis. The one thing that we haven't had is really that place to go for individuals in our community. And we even have, you know, fire and law enforcement co-response teams that pair mental health clinicians and first responders to respond to 911 calls that are related to behavioral health. But again, that location to go is what we've been missing. And really, the PATH Center will help expand that continuum of care. It's not recreating the wheel, it's not recreating services that already exist. It helps expand our continuum and allows for access to be streamlined in an efficient manner for the individual experiencing the crisis. So someone to call, someone to come, and someplace to go.
So some people may not know about some of the, I'm going to call them inpatient facilities that are available now. Maybe expand on that a little bit if you can.
Yeah, absolutely. The current facility that the PATH Center will expand upon is the Spokane Regional Stabilization Center. And like that facility offers 3 different levels of care. And the most of the ways that individuals get referred to that facility is they're in an emergency department and they get transferred, they get dropped off or diverted from by law enforcement. Instead of going to a criminal route, they are able to be diverted to a behavioral health route, or community partners make referrals in the community. The PATH Center will expand the access point for that and have a direct walk-in capacity for individuals to start their care in that crisis relief component and then be transferred to other inpatient care depending on what their need is.
Got it. So that's an important component that we haven't had, which is 24/7, just walk up or be dropped off or come in without a referral or interaction with your law enforcement, emergency rooms, or others. So I wanted to make that distinction because a lot of people don't know of all of the great services we already have. And as you pointed out, this is kind of like the next stage of that continuum in being able to address everything. Anything else from the services that you want to mention, since we have a captive audience right now?
Yeah, absolutely. Well, I think it's important to recognize that kind of as we talk about this continuum, crisis isn't one size fits all. You know, we're not going to have one approach that's going to meet everyone's need, or one crisis intervention that's going to meet everyone's need. And so really the PATH Center is about expanding the ways in which we can respond in our community to individuals and making sure that what we have available meets the need of the individuals when they are having a crisis.
Right. Speaking of crisis, as you know, obviously we've been going through this devastating wildfires and everything that happens with it, and we've talked about it over the last 2 weeks, basically. And I know we've spent a lot of time, effort on that, obviously, as we should. But what I like to say is that there are many components of life that are still there that we need to address. So people are maybe wondering, so why are we talking about this now when we have the wildfires? What is the impact in overall health and wellness of the community that this could be a contributing factor for?
Absolutely. I think behavioral health issues impact our community. And we see that, you know, when individuals aren't able to receive the care at the right time that they need it, it has an impact across the entire system. We know that families feel that. We know that our emergency departments feel it, our first responders feel it, and certainly the individuals that are experiencing the crisis feel it. And so as it pertains to the wildfires that our community has been experiencing, it's an important reminder that behavioral health doesn't happen in isolation.
Correct.
We know that these individuals are experiencing loss, displacement, financial stress, uncertainty, and maybe existing behavioral health challenges that are made more difficult now as a result of the crisis that they're experiencing or the circumstances they're experiencing. So the stronger that our behavioral health system is, and we can build it to be more responsive in moments like this, when our community may be facing additional stress, the stronger and more resilient our community will be able to be.
Wonderful. So I'm glad you brought up the strength and resiliency of the community, because part of our goal is to make sure that we are a strong and resilient community, and that takes a little bit of help from everybody.
Absolutely.
Not that we ever want to see fires like this again, but obviously there are a lot of things that happens in communities that can cause that community level stress, and having this resource will allow us to address that in an even more comprehensive fashion than what we can do now, which I think is it's a great way to approach it. Anything else you think people may want to know? Because I know, and I always say anything else, and I know there's a long list of services and efforts and successes that we have, and I feel bad that we don't usually have the time to go through a whole list, but anything else you want to share with us?
Yeah, I just think, recognizing that this will be and has been a community effort. I think we've had a lot of different partners involved in this, and we'll need a lot of our partners at the table as we build this forward so that we can have a more coordinated effort and in the way in which we provide support for individuals. This will really help tie in that continuum of crisis services as we've talked about, and hopefully be able to assist individuals with more upstream engagement when they're experiencing a crisis, instead of getting to a point where it gets to an extreme.
Right. So a couple of things that I think are important. One, upstream, because preventing the end point of the crisis is always better if we can.
Absolutely.
And second, you mentioned collaboration, which I think is important to highlight. You mentioned the behavioral response unit, all of these other efforts that are ongoing, which are collaborative efforts. But you use a word that is critical, which is coordination. I think over the last several years, we've talked about we do have a lot of great resources, we do have a lot of great providers, but sometimes what hinders our ability to be 100% successful is coordination. I think this will allow one extra level of coordination that will be available to any and all, which will prevent us from saying, well, we don't have the level of coordination that we need to get upstream and prevent downstream effects that we see sometimes with the criminal system or the emergency room, whatever it may be. So I'm glad you mentioned the coordination component, which a lot of people don't think about.
Absolutely.
Because it's critical and it's complicated.
Yeah.
It's not that simple.
And it will be essentially critical to the PASS Center as they're assessing individuals' needs and looking at how they can connect those individuals, to know that we have the coordination amongst the system behind the doors of that to help streamline that assistance for that individual.
Wonderful. And I mentioned at the beginning, broke ground on April.
Yes.
It was pretty cold that day, by the way. I remember I was sitting out there. It was freezing. For April, that was very cold. What's the timeline, estimated timeline?
Yeah, timeline is on track, and we're estimating that it will be complete in April of 2027. And so if you drive by the Boone Street by the STA location, you'll see construction is underway, and we'll continue to have updates along that process.
Wonderful.
But we're anticipating April of 2027.
Okay, so not that far away. I can't believe he's going to say, I just said 2027 is not that far away, but actually it isn't.
That's true.
Time flies when tempus fugit, like they say in Latin. Anything else you want to leave our community behind in terms of messaging or information?
Just that, I think the PASS Center is part of a larger system about accessibility, person-centered care, and our community coming together to provide support to individuals who need it, and that we look forward to the work ahead of us.
Well, thank you, Ashley. Great information. We're keeping our fingers crossed that the construction stays on track, because we do really need that point of contact for the community so we can continue to address mental behavioral health issues as well as substance use crisis. So I'm going to say thank you to all for joining us. Thank you to Ashley and the team over at the Spokane County Community Services. Everybody there, and I'm not going to name everybody because it's a long list of people, but a lot of work being done, and I think sometimes we may not have as much information as we know in terms of what's going on, so I'm glad to do that. So I'm going to say thank you to Ashley, thank you to all of us for joining us, and if you're watching us today and you have questions about the wildfires and some of the recovery that's ongoing, you can go to srt.org. There's a site, contact for the wildfires, and we'll bring you to all of the places that you may want to go, including the EPA activity site and the map, etc. We've been working very closely with all of these agencies to make sure that you have one point where you can go and click and see everything that you need, because obviously a lot of people are going to be dealing with the aftermath of the wildfires for a little bit. And thank you again to all of our firefighters, first responders, and everybody else that came to the rescue. So hopefully everybody, you're staying as safe and as healthy as you can. I do know that we have to dig through the rubble to get back to where we need to be, and I'm confident that we will. And can't believe I'm going to say this either, but some schools are going to start soon. So we need to be mindful of that. So if you need any help, we're here to help you. If you need any documents, we're here to help you. If you need any vaccines, remember our teams are available. And thank you all for joining us. Stay safe, stay well, and we'll see you again next week. Thank you. Have a great day.